Have you ever opened your medicine cabinet, found an old drug, and thought, it's probably still fine? Many people assume that if a medicine looks okay, it must still work. But what really happens when a drug expires goes far beyond just losing strength. Sometimes, the very chemistry of the medicine changes, and what was once healing could actually become harmful. In today's episode of the Pharma Lens, we're diving deep into the science behind expired drugs, why they're risky, what really happens to them over time, and how you can protect yourself and your family from their hidden dangers. When manufacturers print an expiration date on a medicine, it's not random or just for regulatory formality. That date is a final date the manufacturer can guarantee the drug's full potency, safety, and stability under ideal storage conditions. After that point, the chemical structure of the active ingredient can begin to change. Some drugs may simply lose their effectiveness, meaning your body won't get the full benefit, but others can degrade into new chemical compounds, and some of these can be toxic or cause unwanted effects. It's chemistry in slow motion, and time is the catalyst. So, what exactly happens? Over time, environmental factors like heat, moisture, air, and light start to break down the molecules that make medicines work. This process, called degradation, happens differently depending on the drug and its environment. Hydrolysis occurs when water slowly splits molecules apart. This is especially common in liquid medications like syrups and eye drops. Oxidation is when oxygen interacts with the drug's chemical structure, gradually changing its form, a problem often seen in vitamins and injectable medicines. And photodegradation happens when light exposure. Even sunlight sneaking through a window alters light-sensitive compounds. Take aspirin, for example, one of the most common painkillers in the world. Over time, it slowly converts into salicylic acid, which can irritate your stomach lining instead of easing pain. Even more concerning are certain antibiotics, like older forms of tetracycline, which have been known to form toxic compounds capable of damaging the kidneys. These aren't myths. They're documented cases that shaped how we handle drug expiry today. That's why it's never safe to assume that expired just means less effective. Sometimes it can mean more dangerous. Let's go beyond chemistry for a moment. In real-world situations, expired medicines have caused treatment failures, hospitalizations, and even deaths. Not always because of toxicity, but because of ineffectiveness. Imagine using an expired antibiotic for an infection. It might not be strong enough to fully destroy the bacteria, allowing them to survive, adapt, and become resistant. That single mistake can make future infections harder to treat, for you and for others. Or think about insulin, a life-saving drug for people with diabetes. Expired insulin can lose potency, leading to poor blood sugar control, fatigue, or dangerous spikes that could send someone to the hospital. According to the World Health Organization, medication misuse, including taking expired drugs, contributes to treatment failure and rising antimicrobial resistance globally. It's a silent global health problem, hiding right inside our medicine cabinets. And here's the tricky part. Just because a drug looks fine doesn't mean it is fine. Color, texture, and even smell may stay the same while the internal chemistry deteriorates. Some tablets may crumble more easily, while syrups can separate or develop a strange odor, but others show no visible signs at all. Now that you understand the science, let's talk about prevention. What you can do to stay safe. First, always store medicines in a cool, dry place away from sunlight and humidity. That rules out bathrooms, kitchens, and car dashboards. The best spot? A dry drawer or cabinet in your bedroom or hallway. Second, check expiry dates regularly, especially on medicines you don't use often. Create a reminder every few months to go through your medicine box. It takes 5 minutes but could save a life. Third, don't share drugs, especially leftover prescriptions. Even if it's not expired, what works for one person could harm another. Fourth, never throw expired medicines in the trash or flush them down the toilet. They can contaminate water sources and harm the environment. Instead, take them back to a pharmacy or a community drug return program. Many pharmacies now have safe disposal boxes for this purpose. And finally, when in doubt, ask your pharmacist. They're not just medicine sellers. They're trained healthcare professionals who can advise on proper storage, disposal, and replacement of expired drugs. A quick conversation can prevent a serious mistake. Before we wrap up, here's something worth remembering. Some studies show that a few drugs may retain partial potency beyond their expiry, but that's not something you can rely on at home. Those results come from controlled storage under laboratory conditions, not from humid bathrooms or glove compartments in 35-degree weather. Expired drugs aren't just old, they're unpredictable. Their chemistry changes, their power fades, and sometimes they can even turn against you. So before you take that old pill or syrup, pause and check the date. Your health isn't worth the gamble, because safe medicine use starts with awareness. And awareness starts here on the Pharma Lens. Stay curious, stay informed, and as always, for better quality of life.